Thanks for allowing me to present today. I've had a long-standing interest in John Snow and his investigation of cholera in London in the mid-1800s. And given the current COVID-19 pandemic, I thought I would dive into Snow's work and that this would be a useful first seminar for epidemiology for the fall. Now, I will provide a disclaimer, and that disclaimer is that if you participated in Dr. McCormick's pandemics course back in May, you can hit the snooze button because I did have an opportunity to do a similar presentation at that time, although I continue to tweak this and update it. But let's start with learning objectives, since this is a seminar that some students take for credit, and so we start with learning objectives. And since several of the students in the seminar are new students, I want to focus on a few basic epidemiologic concepts: the epidemiologic triad, modes of transmission, and risk factors. In working through John Snow's investigation, I hope to provide you with a sense of the origins of the epidemiologic investigation of epidemics, and then apply some of those core concepts to public health crises today. So let's start with the epidemiologic triad, which posits that diseases can be described and understood by first identifying an agent, so for example, a bacterium, and a host, for example, a person, and the interaction of the agent and the host in a particular environment. Now, for some disease processes, with certain zoonotic diseases, for example, there's a fourth element, a vector, although it's still called the epidemiologic triad. So as an example, a few years ago, we had an epidemic of microcephaly in Brazil, and the investigation identified the Zika virus as the agent. It required certain species of mosquitoes as the vector. The host was the pregnant woman. And for the environment, I include a shot of a particular neighborhood in Miami. This is the only place where Zika was confirmed to have community spread in the US at that time. And so if you can describe these components of the epidemiologic triad, you're well on your way to understanding how epidemics can take place and how they can be stopped and prevented. But now let's turn to cholera, which is the focus of this talk. And let's go to London in the mid-1850s to an area on the north side of the Thames River, specifically number 40 Broad Street, here at the corner of Broad Street and Cambridge Streets. And let me read a couple of paragraphs from Stephen Johnson's book, The Ghost Map. And here he's talking about an infant girl, last name Lewis. We do not know what series of events led her to contracting cholera in late August of 1854 at not even 6 months old. For almost 20 months, the disease had been flaring up in certain quarters of London, having last appeared during the revolutionary years of 1848 and 49. But most of the cholera outbreaks in 1854 were located south of the Thames, and I'll return to that shortly. On the 28th of August, 1854, all of that changed. At around 6 a.m., while the rest of the city struggled for a few final minutes of sleep at the end of an oppressively hot summer night, the Lewis infant, whose name, by the way, was Francis, began vomiting and emitting watery green stools that carried a pungent smell. Sarah Lewis sent for a local doctor, William Rogers, who maintained a practice a few blocks away. As she waited for the doctor's arrival, Sarah soaked the soiled cloth diapers in a bucket of tepid water. In the rare moments when her little girl caught a few minutes of sleep, Sarah Lewis crept down to the cellar at 40 Broad and tossed the fouled water in the cesspool that lay at the front of the house. And that is how it began. Now, we know her name was Frances because this is her birth certificate. Frances Lewis, daughter of Thomas Lewis and Sarah Lewis. And unfortunately, this is her death certificate. Died on the 2nd of September, 1854. And here's the blow-up of the cause of death. Exhaustion after an attack of diarrhea 4 days previous to death. Now, this death and subsequent deaths that took place over the next few days drew the attention of John Snow. John Snow is a 42-year-old physician in London who had already been working on the outbreak on the south side of the Thames River. But when this outbreak began on the north side, he turned his attention to that. Now, we know John Snow today, and we try to stay away from these terms in many ways, but for better or for worse, he is often referred to as the father of epidemiology because of his work with cholera and the outbreak. But he was actually famous before he studied cholera. And I wonder if anyone on the call knows what he was famous for before he delved into cholera.
He was an anesthesiologist, correct?
He was an anesthesiologist, correct. He studied anesthesia. He was among the first physicians in London to do so, and became quite famous in both his study and his application of anesthesia. He, in fact, was invited to provide Queen Victoria with anesthesia during the birth of her 8th child. He was not above including himself in his own experiments. He would be seated at his desk with his napkin or his cloth and a bottle of chloroform, and he would measure out a dose. He would note the time. He would put the dose on the cloth, put it over his face, and pass out. And then as soon as he awoke, he would note the time that he woke. And by doing these kinds of self-experiments, he was able to understand dosing mechanics. But he wrote a famous book on the use of anesthesia. Now, I need to provide some context for the world in which John Snow worked at the time in order to not only understand but appreciate the work that he did do. So again, this is London, mid-1800s. At this time, there were two prevailing theories of disease causation. The predominant theory was the miasmatic theory, which essentially held that all smell is disease. That is, that disease originates from some effluvium, some air that emanates from the earth, and people become sick by inhaling that bad smelling, foul, stale air. It has its roots all the way back from Hippocrates and his treatise on air, waters, and places. And it's reflected even in the names of diseases that we give. So malaria is a good example. Italian for bad air. Thought that people got malaria from the effluvium or bad air that emanated up from swampy water. Many of the cartoons of the day described miasma, and in fact, probably 80 to 90% of the leading scientists at the time ascribed to the miasmatic theory. You can see why this might be so. this whole notion that our noses are more adept than our eyes at perceiving the very small. You know, I'm frequently struck by the fact that I can be walking down University Boulevard, on the sidewalk, that is, and a car passes by me with a window rolled down with someone smoking a cigarette. And, you know, within a few seconds after they pass by, I can smell the cigarette. I can smell it, but I certainly can't see the molecules. Well, in a similar way, there are physiologic connections between the olfactory system and the emotional center of the brain. In fact, the oldest part of the brain, the limbic system, has as its other name the rhinencephalone, which literally translate to nose brain. And you can think of this as having an evolutionary advantage. That is, if something stinks, if it smells bad, don't put it in your mouth, don't eat it. And that indeed was a very powerful evolutionary advantage, but there was confusion and ascribing the causation to the smell itself rather than the things that created the smell. The other leading theory of disease causation at the time was the contagion theory, which held that an agent, some agent of matter, passed from person to person, and that's why people became ill with certain diseases. You can see that pictorial of animalcules there in the right-hand corner. Another piece of context, let's fast forward to today so we set this stage clear. Well, what do we know now about cholera? We know that it's caused by a bacterium spread by the fecal-oral route. The incubation period, that is the time between infection and the development of the first symptoms, is from a few hours to 5 days, with the median incubation period somewhere around 2.5 days. We now know that up to 80% of cases can be successfully treated with oral rehydration salts, and almost everyone can survive with a combination of either oral rehydration therapy and or IV fluids. It causes massive, massive fluid loss through diarrhea. Interestingly, which is something that not many people picked up on, the way to restore health during a cholera outbreak is to return those fluids, to return fluid balance to someone. Unfortunately, the predominant way that people were often treated with cholera was by bleeding, so taking just a little bit more fluid out. It's sort of the irony of ironies that at the same time Snow was investigating this 1854 outbreak, an Italian physician by the name of Filippo Pacini published a paper where he identified the cholera bacterium, microscopical observations and pathological deductions on cholera. Unfortunately, Snow and most other of his contemporaries never saw this paper. And in fact, it was Robert Koch who was largely credited with discovering the Vibrio cholera some 30 years later. Now, one more piece of context as we move on to Snow's investigation of this epidemic. And you can see with this graph on the population of London and the rapid growth in population during this time, an almost tripling in 50 years up to 1850. London at this time was the most populous city on the earth. But let me read you a little bit more, again, setting the stage for John Snow's work. With few exceptions, the problems that the early Victorians wrestled with are still relevant more than a century later. These are the standard social questions that you'll encounter in any textbook account of the period. How can a society industrialize in a humane way? How can a government rein in the excesses of the free market? To what extent should working people be allowed to negotiate collectively? But there was another debate that ran alongside those more austere themes, one that has not received as much attention in the seminar rooms or the biographies. It's true that the Victorians were grappling with heady issues like utilitarianism and class consciousness, but the finest minds of the era were also devoted to an equally pressing question: what are we going to do with all of this shit? Shit indeed. When you think about almost 2.5 million people in London. Now, it's very hard for us to put ourselves in the mindset of those in London in 1850. But London sewers were designed initially only for surface water removal. When you think of engineering and you think of paving over with cobblestones a large surface area such as London streets, rainwater has to go somewhere. And so sewers were constructed primarily and almost exclusively from the beginning to take care of the surface water removal. And in fact, until 1815, it was illegal to discharge raw human waste into sewers. Now, there was an entire labor force, if you will, with many different occupations that were involved in the removal of human waste from places like an urban center such as London. Human waste were either thrown into streets, into cesspools. Cesspools are essentially similar to septic tanks, but they often have an uncovered opening, if you will, or cellars. Again, hard for us to believe, but human waste were allowed to just simply pile up in people's cellars. Even the most strident miasmatists began complaining of the vast quantities of decomposing human waste, which they said was poisoning the air and could make people sick with all of the foul air. So what was the solution that was devised? How do we take care of all of this human waste? We'll route the waste into the sewers, because the sewers flow into the Thames River and can take the waste away. But unfortunately, the Thames River was the main source of drinking water for all of London. So what did this do? And how did John Snow get involved in the outbreaks of cholera in the mid-1800s? Well, he first became interested in the outbreak of 1848. This was an outbreak that originated in Germany, came to London by way of a German steamer, the Elbe. A crewman by the name of John Harnold, who disembarked in London, went into a boarding house and immediately came down with cholera in a place where London had not had cholera for many years. The second person took Harnold's room a day after his death in the same boarding house and died 8 days later. Now, Snow began to build his case for contagion in terms of how cholera was transmitted. But his case for contagion began with his reconciling two seemingly contradictory facts. The same physician examined both Harnold and Blenkinsop, but he did not develop cholera. Yet you could live in the same neighborhood and come down with cholera. The subsequent cases of cholera erupted just a few doors down from Harnold's original lodging house. Another thing that was inconsistent with the miasmatic theory: two sets of flats or houses within yards of each other. Dozens of deaths in one, only one death in the other. And the only difference discernible by Snow was that they had different sources of water. Another thing that Snow picked up on, and which will continue as we talk about 1854, was the difference in the levels of deaths and cases on the north and south side of the Thames. As we'll see in a few minutes, different water companies had different water intakes in the Thames River, different sources, but the deaths on the south side were 3 times that of the north side. Why should this be so if it's just foul or poisoned air that is what is causing people to become sick? So after 2 years and some 50,000 deaths, Snow was convinced that there was a transmissible agent, likely through water contaminated with human waste. Or as Stephen Johnson paraphrased it, it wasn't something you smelled or inhaled, it was from something you put in your mouth. He wrote his first treatise on the mode and communication of cholera in 1849 and published in the London Medical Gazette. So in talking about the 1854 outbreak, we'll talk about 2 different pieces of this, and I've already alluded to this, an outbreak on the south side of the Thames and an outbreak on the north side. Let's talk about the south side first. Now, as I mentioned, probably a dozen different water companies had systems of water supply to households throughout London. And this is a map of the different water work companies within the London environs. On the south side of the Thames, there were 2 main companies. The Suffolk and Vauxhall Company, also called the S&V Company, and the Lambeth Company. And you can see that there were areas supplied only by the S&V Company, areas supplied by the Lambeth Company, and then an area of London just below the Thames River that was supplied by both companies. In other words, houses had interdigitating networks of pipes from these 2 water companies. And you might have one house getting its water supply from the Lambeth Company and the house next door from the S&V Company. So in many ways, John Snow, when he looked at this information, was trying to eliminate differences that might be there in terms of who the different companies supplied water to. So here's the Lambeth Waterworks here at the base of the Hungerford footbridge. And the Suffolk and Vauxhall Company, also referred to as the South London Waterworks, here at the base of the Vauxhall Bridge. Now, prior to the 1848 epidemic, both of these 2 water companies used the Thames in downtown London as their source of water. Again, the most strident miasmatist was convinced that the Thames River was pretty foul, with all of the sewers now dumping into the Thames River and the sewers carrying now human waste. And so in the early 1850s, laws were established requiring companies to relocate their source of water above the tidal flow by 1855. The Lambeth moved its source to above the Teddington locks in 1852, but the S&V Company postponed. It's a little bit hard to see in this Google Earth picture, but here's the Thames River, the big curve. Oh, let's go back up. The curve, here's London, and we're dealing with this south part of the south side of the Thames. But you can see the air distance to the Teddington locks. That's about 12 miles air distance. So above the tidal flow, the Thames is a tidal river, and to a much safer source of water. Again, the Lambeth Company moved its supply there. The S&V Company did not. This is a cartoon of John Edwards, the owner of the S&V Waterworks, depicted as Neptune, god of the sea, or as he was also referred to, sovereign of the scented streams. And you can read some of these little quotes. What torrents of filth come from that Walbrook sewer? Give us clean water, give us pure water, we shall all have the cholera. And so he's sitting, by the way, he's got a chamber pot. You should know what a chamber pot is, on his head. And he's sitting on top of a cesspool that serves as the source of water. I'm sure John Waterbour can translate the Latin up here as the health of the people is the supreme law. So here was the great natural experiment. That's what we refer to this, where just by happenstance, an investigator picks up on a difference not of his or her making, for how two populations, for example, might differ. And so John Snow did some great shoe leather epidemiology and identified houses supplied by the S&V Company and by the Lambeth Company, tabulated deaths from cholera in the households, and then calculated deaths per 10,000 household. And you can see that that households that were supplied by the S&V Company had a tenfold higher death rate per 10,000 houses compared to the Lambeth Company, which again had a much cleaner source of water. And so this was a very, very powerful demonstration, not only of just really good applied epidemiology, but also evidence to further his sense that cholera was caused by some matter that was contaminating water, and that contaminant coming from human waste. So meanwhile, let's go back to the north side of the Thames River. Recall that Frances Lewis, the infant daughter, became ill August 28th. She died September 2nd. By September 5th, there were 83 deaths in the area, 73 deaths closer to a Broad Street pump. That is the main pump there at the corner of Broad Street in Cambridge, a hand pump. 61 of 73 deaths were habitual drinkers of the Broad Street pump water. And within a couple of weeks, there were over 700 deaths within a short distance of the Broad Street pump. Well, this is one of the things that Snow became famous for. He didn't originate the use of maps, but certainly his spot maps of cholera deaths is something that he is remembered for, and something that has made of great use in epidemiology. So each one of these black bars is a death in a household. And so you can see here's Broad Street and Cambridge Street, and there's the corner where the Lewis infant died, with the water pump, the Broad Street pump, right out front. Here's the detail of that. 5 deaths in the Lewis household. And you can see that throughout the area, there's this, this proximity of deaths to the Broad Street pump. There are other pumps in the area. Here I'm pointing out other pumps in the area without this sort of geographic proximity of deaths. Now, very important to John Snow's case for indicating that the Broad Street pump must have been contaminated, and the cause of the outbreak was not only in finding all of these people who whose households admitted to using and drinking from the Broad Street pump, but equally important was finding people or places quite the reverse of that, or quite the opposite of that. Places in the area which did not use the Broad Street pump. So at St. James Workhouse, just across the way, where there were 535 people working, initially 2 and then later 3 more deaths for a total of 5, but very few deaths in a population that large. They used a different source of drinking water at the workhouse. They didn't use Broad Street pump water. Another place, the Lion Brewery, right here at number 50 Broad, again, just a block away. They had no deaths among the 70 workers there at the Lion Brewery. What do you suppose they were drinking? Well, it wasn't Broad Street pump water.
Probably beer.
Yes, thank you, Dr. Waterboard. That's exactly right. In fact, that was part of their compensation for working in the brewery. They got to sample their own goods. You can see here again another example of the spot map and the indication of other pumps in the area, with again here the Broad Street pump dead center. And again, this collection of deaths most closely to the Broad Street pump. And again, what about deaths occurring beyond the Broad Street pump area? 8 of 10 deaths ascribed to cholera were connected to using the pump, using the pump's water. And so the London Medical Gazette said that the really crucial experiment would be that water conveyed to a distant locality where cholera was hitherto unknown produced the disease in all who used it, while those who did not use it escaped. And so right under John Snow's nose there in this area north of the Thames River was this evidence for the crucial experiment. And it came from the Ely brothers. The Ely brothers had a munitions factory nearby on Bond Street. They had 150 employees, and there were large tubs of drinking water there at the munitions factory using Broad Street pump water. And there were many deaths, many people ill who worked at the Ely brothers factory. Now, their mother, Susanna Ely, had moved away from the area a few years previous when her husband died in a munitions factory explosion. So she moved a few miles away, but she had so enjoyed the taste of Broad Street pump water that every week she had her sons faithfully provide her with a supply of drinking water, which they did even during the last week of August in 1854. She drank the water and shared it with her visiting niece, and the two of them both die on September 2nd. So, armed with this information and with spot maps and all the other information that John Snow collected, he made a presentation to the Board of Governors of St. James Parish on the night of September the 7th, where he was allowed to address them and provide evidence. And the Board of Governors voted to shut down the Broad Street pump. And the next day, and this is just 6 days after the Lewis infant died, the pump handle on the Broad Street pump was removed. Now, that was the Board of Governors. The Board of Health, meanwhile, thought very differently. And again, let me read you their conclusion and their very contorted reasoning. So you'll have to bear with me with the language here. The water was undeniably pure, with organic contamination, and we have already argued that if at the times of epidemic invasion there was operating in the air some influence which converts putrefiable impurities into a specific poison, the water of the locality, in proportion as it contains such impurities, would probably be liable to similar poisonous conversion. In other words, the counterfactual evidence is invoked as further proof of the original assertion. The atmosphere must be so poisoned that it has infected the water as well. An example of confirmation bias, the tendency to force new information to fit one's preconceptions about the world. This is, again, a cartoon of the Board of Health hunting for cases like cholera. The scent lies strong here. Do you see anything? Positively, we must find something. It won't do to lose our 20 guineas a day. Oh, if I can but find the smell. Now, John Snow did not work especially on the north side of the Thames alone. He was helped in large part by the Reverend Henry Whitehead, who was an associate curate at St. Luke's Church just a few blocks away. So again, the corner of Broad and Cambridge, the Lewis House, the Broad Street pump. And here's the Reverend's church, St. Luke's Church. Now, part of the Reverend's work, and this was only after John Snow published his updated treatise on the mode of communication of cholera. Whitehead was able to identify what we now know is the index or first case. And he, in fact, on interviewing the mother, found out that she began having diarrhea not 4 days, as the death certificate stated, but 5 days prior to death. It was the Reverend Whitehead then who, upon interviewing and talking with Sarah Lewis, understanding what she did when she washed out the diapers in that bucket of tepid water and where she threw it, that he had the Broad Street pump and the cistern excavated. And this is a schematic of that excavation. But again, let me turn to Stephen Johnson's description to provide you with a sense of what they found when they made this excavation. A local surveyor by the name of York was assigned the task of overseeing, this was a second excavation of the Broad Street well. But this time the cesspool at the base of 40 Broad would be examined too. Number 40 had a waste pipe connecting to the sewer, but the design was flawed on a number of levels. The cesspool at the front of the house had been intended to function as a trap, but in practice it served as a dam that blocked the normal flow into the sewer. Whitehead would later say that York had found there abominations unmolested by water, which I forbear to recite. The walls of the cesspool were lined with bricks that were so decayed that they could be lifted from their beds without using the least force. 2 feet and 8 inches from the outer edge of the brickwork lay the Broad Street well. At the time of the excavation, the water line in the well was 8 feet below the cesspool. Between the cesspool and well, York reported finding swampy soil saturated with human filth. Now, a number of subsequent investigations of Snow's data stated that the outbreak was really over when they removed the pump handle, and too much has been attributed to removing the pump handle. The epidemiologist Kenneth Rothman, who some on the phone may have studied with at Harvard, did a wonderful piece in Epidemiology entitled My Interview with John Snow. And you can see this graph of the outbreak. Here's the peak of the outbreak. And you can see that when the pump handle was removed, the decline was already substantially underway. But Dr. Rothman looked harder at the situation there and came up with this as part of his interview with John Snow, his so-called interview. On September the 8th, the very day that the pump handle was removed, Mr. Thomas Lewis, a policeman by trade who was father to the poor Lewis infant and husband to Mrs. Lewis, became sick with cholera. On that day, Mrs. Lewis once again began to fill the cesspool with excreta from a cholera victim and to infuse the well with the infective agent. But fortunately, the pump was by then out of operation and the epidemic was halted. So although removing the pump handle may not have been the thing that caused this first wave to really come to a close, it actually prevented a second wave. So the infant daughter dies, and there's no more infected water for the mother to pour out front and contaminate the well. So the well does what wells do, and it will wash out and dilute over time. But then again, on September the 8th, they would have seen a second wave had the pump handle not been removed. It was the decision to remove the pump handle that was more significant than any short-term effects, because as Stephen Johnson described, it marks a turning point in the battle of urban man against Vibrio, because for the first time a public institution had made an informed intervention into a cholera outbreak based on a scientifically sound theory of disease. As I mentioned, Snow updated, revised his treatise on the mode of communication and published that in the following year. Now, I want to take just a few minutes to tie this into what we're dealing with now, COVID-19, and talk about some basic fundamental concepts that begins with the epidemiologic triad. Again, we have an agent, the Vibrio cholera, and the host, people, and the environment. The environment, as we've seen, is unsanitary conditions and a crowded population. For COVID-19, we have the agent, the virus, the host, in this case, an elderly person, and the environment, beginning from the Wuhan fish market. We know about the Diamond Princess outbreak and the higher risk care center in Washington State, which experienced an early outbreak. What about the modes of transmission? Again, this became a fundamental piece of John Snow's work. It wasn't something you smelled or inhaled. It was from something you put in your mouth. That is, he set in motion the work that really culminated with Robert Koch and Louis Pasteur in overturning the miasmatic theory in favor of the contagion theory. But what about for COVID-19? What about its modes of transmission? We know that, that these are the ways that it is predominantly transmitted. And why is that important? Modes of transmission become important because I would know, for example, if I've got a child with measles in a classroom, I've got a real problem on my hands with transmission of measles to susceptible children in that classroom. But if I got a child in that classroom with lacrosse encephalitis, I know that's a vector-borne disease, and although that child may be sick, that child's not going to infect other children in the room. And therefore, how I respond to that situation is going to be different from how I would respond to a measles outbreak. Risk factors that some people are at higher odds, higher chances of getting a disease than others. Poor sanitary conditions for cholera, and we now know that other things put one at higher risk of getting cholera. For COVID-19, we have a long list of conditions that place people at risk, including being in a vulnerable population such as people of color, those living in rural areas, and those who are homeless. So as a postscript, just 4 years later, after investigating the outbreak, John Snow suffers a massive stroke and dies at the age of 45. His obituary appeared in the Lancet, and while it mentions his work with chloroform and other anesthetics, it makes no mention at all of his work on cholera. Filippo Pacini got his due finally 100 years later when Vibrio cholera was formally renamed Vibrio cholerae Pacini in 1854. In a March 2003 survey by Hospital Doctor magazine, John Snow was voted the greatest doctor of all time, with Hippocrates coming in second. Again, somewhat ironic because Hippocrates was where the miasmatic theory was rooted. And just as a side note, the EIS on the CDC, the disease detectives, uses the pump handle insignia on their neckties and other bling. What about cholera? Well, 2 billion to 2.4 billion people drink water from fecally contaminated water sources, so those are the people at risk. We know that anywhere from 1.3 to 4 million cases occur each year, with thousands of deaths still occurring each year. Again, with 99% of these preventable with the use of oral rehydration therapy and IV fluids. So if you go to London, as Dr. Lisa McCormick did, and visit there, you'll get to visit a reproduction of the Broad Street pump. And you'll also get to stop by the John Snow pub, which is, again, another irony because John Snow was a teetotaler, unlike the Reverend Henry Whitehead, who enjoyed mixing his brandy, by the way, with water from the Broad Street pump.